what I would call the Q&A ratio. And you can calculate it, very easily. Take your last all four hands meetings, add up the minutes leadership spent talking, then add up the minutes of the real live Q&A. And the real is doing a lot of work in that sense. It means unscreened questions answered in the moment with the CEO occasionally saying, man, I don't know, I haven't thought about that. Then divide the second number, by the first.
Most healthcare organizations have an all-hands meeting. I've been to one. You've been to one. The CEO comes on, smiling, gives an update. The CFO comes in, spreadsheets and graphs, gives numbers. And then a few carefully selected questions get answered, hopefully. Then everybody logs off and claps. The leadership calls it communication because you say it's done. But on the operator, the latest article makes a pretty uncomfortable argument. The all hands has the largest audience in the company, but maybe often produces the least learning. Because when leadership spends an hour talking and 5 minutes listening, the platform, everybody else, learns almost nothing about itself. So, Larry, let's start there. How'd the all hands become a broadcast instead of a conversation? More one way and less two way.
Over time, it didn't happen in one bad decision. And that's the thing people probably get wrong. I mean, nobody ever stands up in a meeting and says, let's make this quarter's all hands safer and more boring, right? What they say is, let's make it more focused, more polished, more on message, more on point. And every one of those words is the same, word, just wearing a different suit, right? So it happens sort of one safe decision at a time. The gravitational pull is toward a real curated, professionalized version, when that's exactly what you don't want on these kind of meetings. Pre-screened questions, slightly less likely to surface the real hard questions if they're pre-screened. I mean, they're people are scared of them, right? And none of those feels like sort of corruption in the moment. Each one is responsible again over time. But within about, a couple of years, few quarters, the meeting that's supposed to be the platform's most open conversations become quarterly press conference. And the best analogy is like during COVID, many companies went to daily, weekly, multiple times a week, all hands on deck type meetings. And they were very transparent and vulnerable. And then when we sort of went back to doing them quarterly, it changed. And that's not just a healthcare problem. It's a gravity problem. I mean, look at Google. They invented the meeting. TGIF, 50% of it was live Q&A. You could ask anything, and Google couldn't keep it alive. And if they couldn't, who could, right? So the company, they built the model, and yet they had the gravitational pull. And so the average multi-site, healthcare or dental platform is not going to resist it, just by accident. But the exact moment it tips is identifiable. It's the prep meeting, where somebody says, why don't we just collect the questions ahead of time so we can be ready? This happened in our Q&A meeting the other day. We didn't allocate enough time. And by the time we got to Q&A, we had gone through the PowerPoint deck, and it was very, very frustrating for me. And I'm like, okay, so I put the meeting through my, AI generator to tell me what went wrong in the all hands. And, here I am trying to preach it, but it's so easy to default into an incorrect way of doing the meeting. And that's why I'm writing about these.
Well, you start this article off on your Substack, The Operator, from the other side of the spectrum, from the other side of the camera, from the viewing angle, in the perspective of a dental hygienist sitting through one of these meetings, hearing the numbers, all the updates, all the growth, while she's or he doing something, doing the actual work or charting or doing some other things, but they're hearing none of the answers she actually cares about. Why is that the right place to start?
Yeah. So the entire failure, of the open, the all hands on is really invisible to the CEO or the, executive team. But it's completely obvious for those that are in operatory 4, if you're a dental hygienist, for example, or in the clinic, if you're a technician or a physical therapist. From the stage, the CEO, we think it's a triumph, but 800 people attended. The meeting ended on time, that the slides look professional. Every dashboard says it worked, but from the operatory, from the PT clinic, They see a meeting that answered exactly one or they answered none of the questions that they really walked into the room with. And oftentimes what you find is the people that attend these meetings are your folks in your back office, not the people who you really want to hear, which those are your frontline clinicians. And so they just stopped attending because they feel it's a waste of time. And when we take attendance, we look at numbers, but not the people on the front lines. So instinctively, every operator reads the company from the top down. But the whole argument of this series, the entire basis is the truth lives on the floor. If you can't feel the meeting from the operatory, from the clinic, from the back room of seeing a patient, you can't fix it in the boardroom. And you'll keep optimizing the things that most people have tuned out on. And notice that the two questions, that the hygienist, for example, wants to know, her pay and a person she cares about, such as her coworker or best friend, the people that people actually talk about at work, compensation and colleagues, right? That's what people talk about at work. Never, ever do any of them make it to one of the slides in your deck, and they should. And so you have to be intentional about, I'm going to start out this meeting by talking about this clinician and that clinician. That's what you should be talking about, not your volumes and not your EBITDA, right? So we build, an hour or half hour long meeting about the company and systematically leave out the only two subjects that everybody who's on the front floor wants to talk about: their compensation, their benefits, and their coworkers.
Yeah, if somebody, I've been at organizations that you're describing where if someone from the audience, if the hygienist or the physical therapist were to ask questions about colleagues or compensation, I've seen this happen. You get a polite answer, non-answer, then that question is moved on. We move quickly on. And then in the background, there's find out who that was, who their manager is. We got to have a talk with them. So the people in the audience understand after very, very quickly, like you said, faster than the leadership team, what this is and what this isn't. So you wrote that an all hands is actually supposed to be the moment when the platform talks to itself. So what's the all hands goal? How do you know if you've succeeded? Because 800 people, attending it should not be the goal, cannot be the goal.
Correct. It is the one venue in the entire operating meeting stack, as I've been calling it, where the floor meets the leadership at scale, at volume, at ubiquity, with everybody participating. Think about how information normally moves, in a hierarchy or a platform. It's filtered, right? It goes up through the site leads, through the regionals, through kind of whatever clinical hierarchy you have, the clinic director, team manager, and every layer sands the edges off. By the time it reaches the top, it's a summary of a summary of a summary. The all hands is the one moment that filtering is supposed to be removed. 800 people get an honest look at the people running the company, and those people get an honest look back. So counterintuitively, the more professional that you look, unless you act that way 24/7, I don't know anybody that does, the more disingenuous you're going to come off. And when it works, when you show vulnerability, when you answer questions honestly and admit you don't know things, it's the single highest leverage hour that you've spent on your operating calendar. I'm speaking from a CEO or an operator perspective. There's no other moment where the entire nervous system over the organization is assembled at one place and at one time. When it doesn't work, it's the most expensive meeting you can ever imagine, all right? Because you're spending an hour of the whole platform's attention, which is the scarcest resource that you own. It's the only thing you produce if the only thing you produce is a CEO or CFO update, everyone could read that in an email in about 4 minutes. Or the way I like to communicate those things is by Loom or video, so they don't have to read anything. If they could have listened to a 2-minute video of me, that should not be what I have in the all hands meeting, right? And I tell operators, this is the 1 hour quarter you can feel the whole body at once. Most of them used to take the body's temperature with a slide deck and never actually touch the patient. And so you have to think of it. These are clinicians working on patients. You have to be management working with your clinicians, and you have to think more in a clinical realm than in a professionalized business sense.
You brought in cost as well.
Yeah.
I was taught early, I needed permission at one of my jobs to spend more than $1,000, but I didn't need any permission to waste 25 people's time for an hour. When you start looking platform wide, 800 people's time for 1 hour, everything stops. Nothing is being produced. It's an opportunity for waste or success or connection. So that was one of the strongest lines I thought in the article. The platform learned nothing about itself. So how can 800 employees attend a meeting and the organization just doesn't learn anything?
Yeah, I mean, there's math here, right? 800 people times an hour of salary equals one big expense. And in some ways, it's actually worse than that framing. It's not just an hour of salary, it's an hour of the entire platform's attention, right? And attention is and trust, and it's more expensive than payroll because you can't get it back and you can't stockpile it. Here's how you produce nothing with it. You design the meeting to flow in one direction. Slides go out, nothing comes back. And an organization only learns something when information travels up. When a question gets asked that leadership didn't already know the answer to. That's the entire mechanism. That's the learning. And now look at what pre-screened Q&A does. The question about compensation gets, well, we annually do a compensation survey and we look at the market, and everything is vetted to be comfortably answered, which means it was vetted to contain nothing leadership didn't already know. So by design, nothing crosses from the floor to the top. You've engineered their learning out of the meeting and you've kept the attendance. 800 people showed up. Participation could have even been 100%. Learning was zero. And the CEO measures the thing by attendance and runtime, the two numbers that have absolutely nothing to do with it, with whether anybody actually learned anything. It's a green dashboard, but a dead meeting. Now, what some organizations do, it's very difficult for a multi-site provider because you can do it at lunch, but that people have clinic during lunch. You can do it early. It's going to eliminate some. You could do it after hours. Some people want to be paid for it. If you're going to invest that much money, you want participation, but you want active participation, not eyeballs. You're not streaming video. You're streaming across exchanged in an in-person, a conversation. And that's what the all hands meeting should be called. It should be an all hands conversation.
You identify 3 potential failures. This is what people like. This felt a little like pick your poison. EBITDA theater, the pre-screened Q&A, which you've mentioned a couple times, and then audience mismatch, either clinical operations and mashing the two. Which one's doing the most damage in healthcare today, or is it sort of just a little bit of all 3?
Yeah, so the way I think about it, EBITDA theater is the most common, and that's ridiculous because your folks don't even know what EBITDA means, and most of the people on executive teams don't really know what EBITDA means. The audience mismatch is probably sort of the most structural, but the one that's the most damage, in my opinion, is the pre-screened Q&A. It does the most damage. And let me be sort of precise, which is sort of the whole point of the article. I rank these by what they cost you. EBITDA theater costs you attention. You bore them with same store comp. You bore them with phrases that have been spoken between, never been spoken between clinicians in the history of the company, right? The audience mismatch causes you relevance. You try to serve operators and clinicians together in one shapeless agenda, and they end up serving sort of neither. But the pre-screening costs you belief. Okay, one costs, the audience is damaging. The mismatch costs you attention. The pre-screen costs you belief and trust, because when you stage a question, you answer that. It's effectively a press conference. The floor is not full. They know exactly what they just watches, and it teaches them that something is permanent, that this venue has been engineered to prevent a real exchanges. It also does a damage from what I have talked about before, which is psychological safety. Is this a place where I am safe bringing things up? And when you get pre-screened answers, the feedback you get is no. I'm asking a question. I'm at a press conference. I'm not seeing vulnerability. I'm not seeing trust. All I'm seeing is pre-screening. And it's boring, and you don't recover from that. Irrelevance you can fix over time with segmentation. Cynicism you do not get back. Lack of trust you do not get back. Psychological safety is too hard to build. And once the floor decides that the meeting isn't real, that's inauthentic, they stop bringing you anything. It's not a all hands meeting anymore. It just isn't. And so you've trained the whole organization to really stop talking to you. That's the most expensive outcome on the list.
Yeah. Well, you stuck on that for a while, that pre-screened Q&A section. You basically argue, like you just did there, many organizations have created that appearance of openness while carefully preventing anything uncomfortable of happening, and it has that negative effect. That feels like it's even worse than having no Q&A at all. We can get to that mathematical formula, which you actually say there is at least a guideline of. So why is this fake pre-screened Q&A worse than having nothing at all?
Yeah, and Jimmy, you've been on the comm side, so you already know, where the room gets built and where it's framed is it's just deceiving, right? And you're trying to protect the principal here. You're trying to protect the CEO and the executive team, and you want to make sure that everybody's not blindsided. Everyone in the room thinks they're doing their job, and they are. But here's why it's worse than nothing. No Q&A is just an omission. There's no Q&A. Everybody knows there's no Q&A. Nobody's pretending otherwise. It's honest by just being present. The pre-screened Q&A is a manufactured appearance of openness, specifically engineered to prevent the openness that it's advertising. Okay, so one thing is not having any Q&A. That's just an omission. Pre-screen is actual damage. It's the absence of something. It's counterfeit. The tell is in one sentence. The CEO never says, I don't know. He never says that's a fair criticism. He's never, I hadn't thought about that way. He's never shown any sense of vulnerability. That's not a conversation. It's man reading. It's reading a room and responding to a curated input stream. And the part that's unfair to the comms team, to folks like you, is that nobody in that prep room is assigned to represent the floor, to represent the clinician. Everybody's representing the CEO. They're kowtowing to the CEO. So, of course, the meeting comes out optimized for one person in a building of about 800.
One thing I kept thinking while I was reading this, I jotted this down, was what do leaders actually want? If everyone's just there to support the CEO from the production side, what do leaders actually want? What are they looking for? Do they want feedback or do they want confirmation? Because your article suggests those two things are very different things.
No, it's great. I think what they really want, Jimmy, is honesty. Most want really, confirmation. A few people just want airtime, right? And generally, there's those that want feedback. And the beautiful thing is that you can tell which one you're dealing with inside. I would say within about the first 90 seconds of a real Q&A. But watch what happens when a hard question lands. And I've been in this seat before. The leader who wants feedback leans in. They get visibly curious or interested, because a real question is the most useful thing that's happened all hour. So it's exciting. And the leader who wants confirmation gets defensive, or worse, they demur. Or my favorite is they say, well, I'll flip that over to HR, or I'll flip that over to our general legal, leader. We'll talk about it offline. I mean, the question I put to operators is simple, and it also makes them squirm. When's the last time somebody changed your mind in a meeting? It's a mentoring question I ask. When did you admit that the data that you were feeling or seeing, inculcating, conflicted with what people were telling you, and you literally changed your mind? If you can't relate to a specific instance, you haven't run into the very conversations as a leader that you should be having with your folks. What you're running is broadcast. You're running spin. And you've been mistaking the silence in the room for agreement and consensus, when it's actually people who've just checked out. They've just stopped trying.
You proposed a pretty radical idea for healthcare companies anyway. Take live questions. Don't screen them. Let the audience sort of upvote them and answer them in real time, what the floor is actually thinking about. Why are leadership teams in 2026 so uncomfortable with that? And then what is that discomfort actually? That feels like a data point. What does that tell us?
Yeah, it's interesting. I've been at real meetings where they do that. They have all these questions and they vote on the questions, through all these various tools that you've seen that all of the meeting, software have. But the discomfort's the single most honest point in the entire exercise. I want to say that even harder in the article, if your leadership team is uncomfortable taking live unscreened question, that discomfort is information. And here's the part that people miss. The audience also gets uncomfortable too. You're not the only one with something at stake in there. You've been in meetings where somebody asks a question, you're just, you're getting, all uncomfortable in your own seat too. Um, and leadership is uncomfortable because live questions remove the one thing that the entire meeting was organized to protect: controlling the narrative, controlling the spin. You cannot pre-write the answer to a question you haven't seen. And for a leader who's used to a scripted room, that loss of control feels like free fall. When that loss of control, you have to normalize, and normalizing discomfort is a saying that I love to say in our company. But to turn it around and when the discomfort, it should feel useful, because fear has a shape. And there are 3 or 4 specific questions, by the way, that you're hoping nobody stands up and asks. And here's the move I give every operator. It's the most important thing in this entire episode, Jimmy. The next time your comms team wants you to pre-screen, let them. But make them tell you which specific questions they're screening out. Don't argue with them. Just write the list down. That list is your real agenda. Those are the conversations your platform really needs to have and has been avoiding. The discomfort was never a reason to skip the live Q&A. It's the map to the meetings that you should be trying to run all along.
Yeah. Show me what you're scared of. Show me what you're avoiding, and I'll tell you what we should lead with right out of the gate. That should be the intro. Here are the things we are going to talk about, and if the audience doesn't lean in, you got the wrong group of people, or you're avoiding the real problem.
Exactly.
You end the article on your Substack with a line that I loved. Ending 61 seconds early was never the achievement. 800 people out of 816 attended is not a goal. It was the sound of a room with nothing left to say to each other. So if a CEO or a director or someone who's on the camera side looking into the camera for meetings like this right now and listening wanted one measure to determine whether their all hands is working or not, what's for their language, what's a KPI?
I think it's what I would call the Q&A ratio. One number, and you can calculate it, very easily. Take your last all 4 hands meetings, add up the minutes leadership spent talking, then add up the minutes of the real live Q&A. And the real is doing a lot of work in that sense. It means unscreened questions answered in the moment, with the CEO occasionally saying, man, I don't know, I haven't thought about that. That's a fair criticism. That's a perspective that I hadn't thought of. Then divide the second number, by the first. Google, by the way, their original target was 50%. Slido, which is another organization across companies, recommends at least 20%. The healthcare platforms I watch run it closer to 5%. Under 10%, you're running a press conference and a broadcast, and you're controlling the story, and you've got spin control. But just to be honest, if that's the case of what you're going to do, and you're going to do pre-screened questions, don't take any questions. Just call it a quarterly update. There's nothing wrong. It's just not an all hands meeting. If you're under 5%, it's probably because your floor has stopped asking questions, because they've stopped expecting the same old answers. And on the line that you quoted, ending 61 seconds early was never the achievement. The exec team mentions it with pride because they think they finished early. They think that signals discipline and efficiency and respect for everyone's time.
They say, we'll give you that 61 seconds back in your day, man. If anything needs to disappear, it's that.
No, that's exactly right. And here is the interesting thing: is it goes to the basics of efficiency versus effectiveness. With efficiency, be a systems thinker. With effectiveness, be a people thinker. In all hands is meant to be an effectiveness meeting, which means time should not be constrained. The best all hands meetings run 11 minutes or so longer, because the questions wouldn't stop, and the CEO refused to cut them off and said, look, I'll be here as long as there are questions. I can remember this during the COVID days, man. I remember getting over 100 questions during one of the COVID meetings, and they were tough and painful and vulnerable. And, we made the decision way back then that we weren't going to lay anybody off, or if we were going to, balance the part-time with whatever, dollars we were going to get, because we were, at that time we weren't able to take, the dollars because we had some PE investment. And man, we didn't lose anybody. We didn't have shortages and those kind of things. We just kept everybody together. And I think it was because in those meetings, we just tried to make everybody feel secure. And if we didn't know something, we didn't know it. Who knew what the heck the next stage was in COVID after the first week, after the second week? And by the way, nobody thought about bragging that I'm giving time back to you, right? Nobody cared that the meeting went long. They were just too busy talking and engaging, with what you were saying.
You also had something, I don't have the exact quote. Pay attention to your last 4 all hands meetings, the questions that were asked but not answered. If they keep showing up, that's a trend. And if the audience, the floor is continually asking and you're uncomfortable answering, that's a good thing for now. But once they stop asking, that's the real loss.
No, that's right. Avoidance is not a good strategy in business. Problems, as I like to say, grow in weeds. Your job as an operator is to get as much water away so that the weeds drown out. And that should be intuitive in those that are in healthcare, because do we ever say to a patient, who comes in complaining about their problem, do we ever say to them, don't ever bring me a problem unless you can bring me a solution? No, we are paid to help with solutions by having conversations that are meaningful and that create psychological safety. And the more you could be proactive about addressing uncomfortable conversations, the better as an organization you are. And the more you'll grow and the more trust you'll have. And the conversion for that will be KPIs like retention.
Yeah. You want to give a forward tease? This was the end of the meetings series, right? What's on the chopping block next, or what's been bothering you?
We have one. We have one more. We have the audit. So the 6th article will be on how to audit the meeting stack with checklists and other things. And so it's just kind of a summary article, if you will. But I'll tell you what's been on my mind, Jimmy, and that's those companies that recruit by saying they have mentoring programs. So we're going to talk about mentoring and retention and turnover. And it's interesting what the data and the research say about all of this. And I think, again, it's this whole idea of we use words to recruit, mentoring. Then they get on, and 90 to 120 days later, where's this so-called mentoring that I had? And so that's been on my mind a bit lately as well.
Buyer beware, the words that we use to get someone to show up, but where's that thing when we want them to stick around?
Yeah, I'm going to give you one more, by the way, Jim. I'm going to give you one more. So the other thing that's been on my mind is what we have seen in the economy the last several weeks is there has been in healthcare a slowdown in new patients. And I'm not saying this in a specific sense, but in a universal sense. Less new patients are accessing dental and healthcare services and physical therapy services. Part of that is copay. Part of it is probably the economy, right? When you're paying more money for gasoline, you have other kind of things, and so then everybody looks at their marketing department and says they're not doing their job. And so I've got a whole series I'm looking at on how marketing is your company's responsibility, or is it the clinician's responsibility? Yes, there's an element of both, but the real healthcare practitioners, the real dental professionals assume the responsibility of building their practice, and they assume it by referrals that reveal, not by gimmicks and lead generation and purchasing and more Google ads, but by conversations and care and consistency, clinical excellence, customer service, care, and compassion excellence. Those will reveal referrals that you don't even ever have to ask for.
All right. Well, subscribe to the Substack, The Operator. For how much, Larry? How much does it cost to subscribe to the Substack?
$0. It's free.
This month, 50% off of that as well, if you subscribe. Yes. This month. Most leaders think
you refer a friend.
If you refer a friend, a lot think the all hands exists to communicate information. Larry would argue it exists to gather information just as much as it does to communicate it. Because when leadership spends an hour talking and 5 minutes listening, as Grandma said, you got 2 ears and 1 mouth. You use them proportionately. The platform learns almost nothing about itself unless you listen.
Your grandmother is a smart lady, Jimmy.
Yeah, she's quick. If today's conversation made you rethink how your organization is communicating and made you a little uncomfortable, good. That's sort of the point. Subscribe to that operator on Substack. Until next time, keep operating. Larry, thanks for the time.
Thank you.